Well, Tiana, thank you so much for coming in. I definitely appreciate it. We have a strong relationship with ECPI University, so anytime we have a position available for a medical assistant, we like to give them priority. We let them come in and interview first. We have an educational partnership with them, so ideally we would like to have ECPI graduates on our team. Can you please tell me a little bit about yourself?
Um, I'm Tianna Johnson, in 5 weeks I will be going on my internship for medical assisting, and then graduating soon in May. Um, I am certified in phlebotomy, billing, coding, EKG, and I'm a BLS provider.
Okay. What about your work experience? I know I spoke with your program director and he said you had already been working in the medical field. Can you explain a little bit to me about where you're working in the medical field?
I'm working with Hand and Heart. It's a home care agency. Basically, I just take care of people and help them, assist them with stuff that they can do on their own, like bathing, um, grooming, feeding, and like I can't give them their medication, but I supervise them taking it, and that's about it. Put them
Okay.
in bed, and
Okay. That's good that you've been working at a facility and you have some patient care experience. Well, let me tell you a little bit about our practice. Our practice, River Cities Cardiology, is a thriving practice. We have uh, a number of cardiologists on staff, as well as nurse practitioners and physician's assistants. The other positions are all fielded by medical assistants. We have multiple offices, so our doctors will go to multiple offices throughout the week. And what we typically do is pair a physician with a medical assistant. So if the doctor is scheduled to be at one office location on Monday, Tuesday, Wednesday, and a different location on Friday, then the medical assistant is going to follow along with that cardiologist. So would that be a problem? Okay, very good, very good. Our medical assistants are going to be cross-trained. They're going to be trained in scheduling and follow-up. They're going to be trained in physician's office laboratory. Again, we do everything in-house, so we do our own blood draws, our own analysis. So you would be receiving that type of training as well. Our medical assistants are going to be in the clinic, so they're going to be performing mensuration and vital signs, reconciling patients' medications, doing any kind of patient follow-up that's required. And they're going to also be doing medical billing and coding and revenue cycle management as well. We do have our own cardiac catheterization suite. We do, again, everything in-house. And ultimately, if the medical assistant shows proficiency and they are here long enough, we will train them to go into the cath suite with the cardiologist to do interventional cardiology, cardiac catheterizations, and stent placement. So again, we do everything under this roof. The only thing we do not do is if a patient, if we do a catheterization, determine that they have to have a bypass surgery, we do send them to the hospital for the bypass surgery. But just short of that, we do everything else here under our own roof. That way we know it's done to our standard. So again, it is a busy practice. Each advanced practitioner is expected to see 40 patients per day, and essentially that is a patient every 15 minutes. So you will definitely be busy while you are here at River Cities Cardiology. Tell me a little bit, you mentioned multiple certifications. Tell me a class at ECPI where you felt like you really excelled.
I did pretty good in all my classes. Um, but which one I feel like I really did really well in was EKG.
Okay. Well, Glad to hear that. Coming to a cardiology practice, we definitely are going to expect our medical assistants to be very proficient with EKG. Of course, we know you have to stay within your scope of practice. It's not within that scope to make a diagnosis. But if a cardiologist asks you to perform an EKG on a patient and you see something that is in fact, not within normal limits, we know that our medical assistant would be qualified to very quickly seek consultation from the cardiologist. Having said that, we will always do a shadowing interview in addition to a typical interview. If I could have you step over to the board for me, please. Since you mentioned EKG as being one of the classes where you were proficient and you have EKG certification, could you draw for me, please, one cardiac cycle with the EKG waveforms? Okay. And could you tell me a little bit about what each part of that waveform means?
There's a big P wave. It means atrial dipole, and then the QRS wave is the ventricle depolarization, and then the T wave is the atrial repolarization.
Okay. Okay, good. All right, and I know you also have a phlebotomy certification. What is the main vessel that we would use to draw blood from a patient?
The anticubital thing.
Okay, okay. All right. Go ahead and have a seat now. One last question. Let's say that you have a patient that one of the physicians, the physician that you work with, has just made the diagnosis that they are a newly diagnosed diabetic. And so the patient is very upset about the fact that they now have this life-altering disease that they're going to have to manage very, very strictly for the rest of their life so they won't have any complications. Can you tell me how you would deal with this patient's feelings because they have just been given this news that they now have a life-altering disease? And how would you also educate them on how to maintain their health during the course of this disease?
I would just be very, I'm not going to say lenient, but just listen to the patient. I would educate them about, stuff they can eat and stuff that I know that's good for them to try. And I mean, that's about it. I mean, I would just listen to the patient.
Okay. In maintaining their health with diabetes, what's probably going to be the most important thing that they do on a regular basis to maintain their health?
Check their blood sugar.
Okay. And what's the device that we use to check their blood sugar? That's okay. That's okay. So far, I've done most of the talking, it seems, but do you have any questions for me to follow up? Okay. All right. Well, very good. Well, what we'll do is we still have some more ECPI grads, and hopefully we find who we need from ECPI, and we don't have to strike out on Indeed or anything like that to get more applicants, but we'll definitely be in touch very soon.
Okay, thank you so much.
Thank you. Very good.